Cast Care by Hayley, Dave, and Jolene.
A cast is a bandage consisting of a firm covering that immobilizes broken bones while they heal. Casts also help to prevent or decrease muscle contractions and are effective at providing immobilization after surgery. Casts are made out of either plaster or fiberglass material and can be wrapped over cotton or a waterproof material. The type of cast depends on the type of injury you have. Plaster was the original material used to make casts. These casts are made from pieces or rolls of dry mucilin that have starch or dextrose and calcium sulfate. When this material gets wet, a chemical reaction occurs that causes the cast to harden when it dries. The advantages of plaster are that they can be molded much more precisely to the injury and are much cheaper than fiberglass. The disadvantages are they are more timely to apply and they take up to 2 days to dry. They are also bulky and heavy in material and are less durable. The major disadvantage is when the plaster cast gets wet, it becomes soft, loses strength, and it may no longer adequately immobilize the injured area. Fiberglass casts are the most commonly used today and come in a variety of colors. The advantages are they are lighter weight, longer wearing, more breathable than plaster, they require less maintenance, and can be lined with waterproof material. The only disadvantage of a fiberglass cast is that it is more costly. A waterproof cast is made from fiberglass and a waterproof material called Gore-Tex. Gore-Tex is completely waterproof and allows a patient to completely immerse the cast in water without requiring the protection of a plastic bag. The advantages are it allows the cast to get wet, keeps cast from smelling, and there's less cast care needed with children. The disadvantages are it is costly, it takes longer to dry, and it is not as comfortable as cotton. Also, this is not used on elbows or ankles due to the risk for pressure sores and skin irritation. It is also not used after surgery due to the risk for infection.
Swelling due to your injury may cause pressure in your cast for the first 24 to 48 hours. This may cause your injured arm or leg to feel snug or tight in the cast. To reduce the swelling, it is important to elevate your injured arm or leg above your heart by propping it up on pillows or some other support. Apply ice to the injured area and exercise the fingers or toes to decrease swelling and prevent stiffness and to increase circulation. The use of over-the-counter anti-inflammatory medications such as ibuprofen may also be used. Now we're going to check in with Jolene for some additional instruction.
Alright Dave, now that you're home, it's important over the next 24 to 48 hours to follow a few instructions to reduce inflammation and swelling. The first thing you want to do is elevate your arm above your heart, and you can use a pillow to make it more comfortable for you. You can also use something like an ice pack to help reduce inflammation and swelling. Also, over-the-counter anti-inflammatories like ibuprofen will help reduce inflammation and swelling as well. And the last thing you want to do is wiggle your fingers as tolerable, and that will help increase circulation and decrease stiffness.
Keeping your cast clean and dry is one of the most important aspects of cast care. When bathing, it is easiest to take a bath instead of a shower and simply dangle your injured limb outside of the bathtub. Check your local pharmacy to see if they sell a cast cover made specifically for bathing, or you can choose to make your own by putting a bag over the cast and securing it with tape. It is important that you don't submerge the cast while it's like this because water may still get in and damage the cast. If the top or the bottom of the cast gets a little bit wet, try drying it with a blow dryer on the cool setting. Walking with your cast. It is important that you don't put any weight on your cast unless the doctor allows it, otherwise you might affect your proper healing. If you are allowed to walk, make sure you wear a cast boot provided by the doctor, and this will keep the cast from breaking or wearing down. If you need crutches to assist you with walking, be sure that they are fitted properly.
There are a lot of things important not to do when you have your cast. One of the most important things not to do is get it wet. This is one of the most common reasons that people have to get their cast redone. Don't stick anything in your cast either to relieve itching. A lot of people try to put forks or spoons or wire hangers down there, and it often can cause skin tears and cause infections. Do not apply any powders or deodorants to avoid itching skin. Don't pull out the cotton lining either. It's there to protect you. Don't break off the cast or try to trim it with a knife. This is very important. What to watch for when you have your cast. You should frequently inspect the skin around your cast. You should seek medical attention if you notice any of the following changes. If your fingers or toes turn blue or gray, if there's loss of movement in your fingers or toes, if you notice increased pain or swelling, if there's any bleeding or drainage from the cast, if the cast becomes too loose or breaks, if the edges are causing the skin to become raw and irritated, if there is unexplained fever, or if there's any burning or rubbing inside the cast. When it comes to problems with casts in the emergency room, the most common preventable problem is a wet cast. It is seconded by a damaged cast, then loose cast, a tight cast, and then pain. Having a cast doesn't have to be that bad. You can make it fun. There's plenty of things you can do. You can have your friends sign your cast. You can even get cast-tos, which are tattoos for your cast. Get bright colors. Dress it up. It doesn't have to stink. For more information about cast care, please visit www.childrensortho.com.